They couldn't even come up with their $5,000 medication in a timely manner, let alone come up with the one that cost pennies. If you lost all your hair due to an unexplained autoimmune inflammatory syndrome, there's a new drug that you can use. Baricitinib has now been green-lighted by the FDA for use with this alopecia condition, which seems to be affecting more and more people, and most recently and very visually, Jada Pinkett Smith. It already has been approved to treat rheumatoid arthritis, as well as many other autoimmune conditions, and COVID-19. Now, what is the connection there? The connection there is that when people die of COVID-19, if it's allowed to get far enough, they experience a cytokine storm, which means that the immune system is basically killing the body. So what is the connection between something caused by what scientists say is a zoonotic disease derived from animals and a condition simply known for the body's tendency to attack itself via the immune system? I'm Tatiana Prophet. I'm an award-winning journalist. I went to Northwestern University's Medill School of Journalism. I studied both print and broadcast, and I have worked for daily newspapers, weekly newspapers, and bilingual newspapers, English and Spanish. If this resonates with you, leave a like and a comment, and please share and subscribe. Thanks so much. Autoimmune diseases are often related. They often use similar medications. So it's not a big surprise that the FDA actually approved baricitinib for extremely ill patients in the hospital with COVID-19. The most common side effects associated with the drug include upper respiratory tract infections, headache, acne, high cholesterol, according to the FDA. The rare side effects include cancer, heart attack, or stroke. Another treatment that's used for rheumatoid arthritis and lupus as autoimmune diseases is Plaquenil or hydroxychloroquine. The side effects for Plaquenil are generally mild. The rare side effects can be loss of vision in long-term use, as well as heart issues. Now we know those are extremely rare. Why didn't they finish the clinical trials with hydroxychloroquine in the appropriate dosage? Why? They still haven't finished them. This is a drug that calms the inflammatory response of many autoimmune diseases. And it's cheap and generic. This was just May 11th, 2022. Amazing, isn't it? So what is the connection here between COVID-19 and alopecia areata, if any? Well, doctors would say none. They just happen to be autoimmune diseases, and along with rheumatoid arthritis, psoriasis, lupus, and they involve intense inflammation around the body that your immune system attacks the body. Many side effects from COVID, especially long COVID, are also similar side effects that we've seen in reports from those who have taken the vaccine. And the reason why is that this mRNA vaccine actually teaches your cells to create the spike protein, thereby inducing an immune response. The problem is there's been recent studies now that have come out that say that this mRNA, this messenger RNA, does not just stay at the injection site, but does reach all over the body. And if that is the case, then the spike protein is reaching areas where the ACE2 receptor is, which is your brain, your heart, your lungs, your kidneys, your intestines, and even your white blood cells, macrophages, etc., and red blood cells. So that's a problem if we have runaway spike protein creation. As the news articles pointed out, baricitinib is the only approved treatment for alopecia areata by the FDA at this time. And baricitinib only costs $2,500 for a 30-day supply. On the other hand, Plaquenil, or hydroxychloroquine, Plaquenil costs just a few dollars a pill. Seems to me the only difference is the side effects on drug makers' pocketbooks.